I'm Dr. Ingrid Hall at Cosmetic Image Clinics, and here at Queensland's largest cosmetic clinic we do a lot of cosmetic mole removing, and it's a very commonly done procedure, even though a lot of people don't know that you can just simply have a little bit of local anaesthetic and plane off the mole, just simply shave it off. A lot of people are under the impression that you need to go to your local doctor, have stitches and then get them removed a week later, and it's a major undertaking. But it's a lot simpler for a lot of people, and you can even have a far superior cosmetic end result if you shave it off rather than get it excised and stitched up. So this is quite a wonderful procedure for planing off these raised moles that people have on their face, neck, back, anywhere in their body. We can remove them.
Hello Robin, how are you doing?
So today we're having a patient coming in who's got a mole on her face, and what we're going to do is put in some local anaesthetic, plane it down flat, and voila, it'll be healed with very little residual impact. So you can often see the moles being there, that the skin texture is slightly different, but it's a lot less noticeable than a raised darker mole, and sometimes you can't see any skin textural changes whatsoever. So some people can't even tell that there's been anything there, but sometimes it's a little bit lighter than the surrounding skin. So the patient will have an examination of their skin by a doctor here. Sometimes we look through a dermatoscope, which is a kind of a magnifying loupe for skin lesions, so we can see it in more detail. If there's any requirement, we'll arrange a biopsy of the lesion as well as we do it and send it off to the pathologist. A lot of people have a simple garden type variety mole and they don't need to have a biopsy, but we can do that if there's any concern or suspicion whatsoever. And so then the patient comes into the room, we lie them down on the bed, and then we actually put some ice on the lesion and often use a vibrating instrument to take their mind off the local anaesthetic injection. And the cold ice that we apply numbs it fairly well as well. And then the local anaesthetic goes in. After that, it's perfectly numb. Then we have a Surgitron Elman diathermy machine, and diathermy machines are very frequently used in operating theatres and hospitals, and they tend to cauterize the blood vessels as it goes along. So you have a largely bloodless field compared to if you used a scalpel, for instance, where you can't see what you're doing and what level you're at. So this is a very helpful tool in planing it down very accurately, down to the level of the surrounding skin. And so then the client often smells a little bit of diathermy inhalational smoke as we're doing it, which is perfectly normal. So it's a painless procedure, it's quick, it takes about 5 minutes. After the lesion is planed off, there's often like a little cigarette burn wound that's there, and then we cover that up with a Band-Aid. The next day they can apply a cold sore patch, which is like a little bit of see-through Glad wrap stuck onto the skin. You can barely see it, you can even put makeup on top of it, and then you leave that little patch on until it's all healed. This takes on average a couple of weeks, sometimes longer, sometimes shorter, and after that there's a bit of redness that can persist like any healing wound for up to a couple of months, and then the end result, which is often a nice flat area of skin where the mole was, is achieved, and people often marvel at the results that they receive.
Oh gosh, you wouldn't even know I had one there. That's
No,
fabulous.
Great.
Yeah.
Excellent. Good stuff.
Thank you so much.
My pleasure, Robin. Any concerns or worries, you know where we are.
Yes. Good.